Welcome! In this video, I'm breaking down the clinical features of Thalassaemia Major, a severe inherited anemia caused by defective V-globin synthesis. Let's start with when it shows up. This disease usually appears within the first 6 months of life, right after fetal hemoglobin drops off. Since V chains are either missing or reduced, red blood cells get destroyed much earlier than they should, leading to profound anemia. So, what does that look like? Infants will often present with media group, pale baby, infant looking weak, baby having trouble feeding a stock, distribute equally, progressive pallor, noticeable weakness, trouble feeding, and a failure to thrive. In other words, babies just aren't gaining weight or developing as they should. Next up, hepatosplenomegaly. You'll notice an enlarged liver and spleen. Why? It's the body's way of trying to make more blood cells outside the bone marrow, what's called extramedullary hematopoiesis, as well as dealing with the constant destruction of red cells. Then there are the distinctive bone changes. Bone marrow expansion causes skeletal deformities. Think media group, animation of frontal bossing, prominent cheekbones, child with noticeable facial features, and stock age or distribute equally, frontal bossing, prominent cheekbones, and maxillary hypertrophy, giving that chipmunk face appearance. On X-ray, you might even see a hair-on-end pattern in the skull, which is classic for this disease. Growth retardation and delayed puberty are also common. Chronic hypoxia and iron overload mean these kids often don't grow as expected, and puberty can be delayed. Don't forget about iron overload, also called hemosiderosis. It happens because of repeated transfusions and increased gut absorption of iron. The extra iron builds up in organs like media group, diagram of heart with iron buildup, pancreas with iron deposits, eye stalk, distribute equally, the heart, pancreas, and endocrine glands, leading to complications like heart failure, diabetes, and hypogonadism. And lastly, recurrent infections are a big risk. The spleen doesn't function well, and repeated transfusions further weaken the immune system, so infections are common. To sum it up, Thalassaemia Major presents early in life with severe anemia, bone deformities, organ enlargement, and complications from iron overload. Early diagnosis, regular transfusions, and iron chelation therapy can make a huge difference in survival and quality of life. Thank you for watching. Subscribe for more medical videos.